let me go on to this. Artificial intelligence, its frontiers and powers, how it may influence my professional work and life as a clinician, a SWOT analysis. And I do a lot of reading. He has given a topic which puts you into a lot of, is very provocative and very attractive sometimes, and very tempting to go ahead with this preparation. This one? Yeah. So it's a pleasure to be here today to explore a subject that is rapidly transforming the landscape of healthcare, that is artificial intelligence in medicine. As we stand on the cusp of a new era, artificial intelligence is not just a futuristic concept, but a present reality that is revolutionizing how we diagnose, treat, and manage diseases. From enhancing diagnostic accuracy to personalizing treatment plans and predicting patient outcomes, AI is empowering healthcare professionals and improving patient care. Today, we're going to delve into the exciting developments in this field, the challenges we face, and the future possibilities that AI brings to the world of medicine. So let us embark on this journey to understand how AI is reshaping healthcare, making it more efficient, accessible, ultimately, most important, more human. Now, this is not my introduction, because I asked this question to ChatGPT. So I asked, would you kindly give me a few words of introduction to a talk on AI in medicine, please? So ChatGPT, that is Chat Generative Pre-trained Transformer, that's what it stands for. It says, certainly, here is a brief introduction you can use to kick off a talk on AI in medicine. Now let me come to my introduction. And we have been using AI in most of the places, in most of the fields. The growth of AI in medicine has been termed as the fast and the furious. So it has grown very fast and is furiously growing, and it is important on our part to keep pace with it and try to adapt this into our practice so that we improve our patient care. Now, as I mentioned, we are adopted in various fields already. You see, for example, the ball tracking you see in cricket, whether it's going to be hitting the wicket is LBW or not, or Hawkeye, Ultra-Edge technology and ball tracking data combined together to tell us whether he has edged the ball for a catch behind the wicket. So most of the other fields have been using. Now, why should we know about AI in medicine? Basically, the market is growing and is expected to increase to a value of $45 billion by next year, according to a number given, this is from US data. And by 2026, it is projected that AI would have saved, I think it has cut off my AI, I don't know. It would have saved many more $1 billion by 2026, what you have spent on AI. It saves a lot of congestive cognitive load and frankly, time that a doctor can then spend in the fun part of being a doctor. The fun part of being a doctor is being with your patient. So what they say is you learn, get things from AI readily available on your table, and you can spend more time with your patient. Automation won't replace physicians, but probably those who are using automation will replace those who do not use it. So it's better we learn artificial intelligence. Now we need to understand the definition of some terms, because without this you will not know what it means. One is SWOT analysis, as Dr. Nagaraj has given us. Mostly it is followed in most of these business companies. What they do is, in their meetings, they discuss the point to work. They discussed strengths and weaknesses. Strengths and weaknesses of their Strengths and weaknesses they discuss, which are basically internal matters. How strong is the company and what are the weaknesses? And what are the external factors? They look at the opportunities and threats they face from outside. And they use these points in the discussion and build a strategy for their growth. That's what we should do. Go through these points and build our own strategy, how to learn this and how to adapt into your practice. So SWOT analysis can provide a comprehensive view of the influence of AI on clinicians' work and life. Now, what I will do is next few slides will show where this AI has been helpful in various fields like ECG, echocardiogram, your records, your GP's practice, prediction, and education, clinical trials, etc. I'll just quickly show one or two slides on each one of them. Then we go to SWOT analysis. Now, artificial intelligence, the capability of a machine to imitate intelligent human behavior or perform tasks that typically require human intelligence. Deep learning, a subset of machine learning that uses artificial neural networks, like it works like a brain network. Foundation models, here machine learning models trained on a large amounts of unlabeled data that can be used for different tasks with very little fine-tuning. Can't fine-tune it. Large language models, type of machine learning model trained on large amounts of text to recognize, summarize, translate, predict, and it can give you various documents. A subset of artificial intelligence with computers learn from experience without explicit. I think some of the slides are not coming properly. Is this okay? Now, in the field of diagnosis, let me go through quickly some of the slides or studies which have been done. Now, here is from ECG. If you give an ECG to this AI, it will tell whether it will identify the gender, male or female. I wonder whether they use it in this Olympics. And it will also tell the age of the physiologic age of the patient or particular subject. Now, if it gives you somebody's age, he is 50, but it gives the age as 57. What it means is it has taken into consideration his background, his other illnesses, and it means he is 7 years older than actual physiological age. Means he has some health risk involved in this patient. Then we all try to diagnose cardiac amyloidosis. Many of them are probably underdiagnosed, and here is one where AI is expected to play a bigger role in better detecting, classifying disease, and they studied it 1.3 million ECGs from 3,41,000 patients, and from ECGs they could say that, of course, it will be fed the other data about the patient's physical findings, etc. Based on that, it can diagnose the amyloidosis. Then you have this, when patient gets an echo done, he gets that report typed and given to him and he goes away, but when he reads it, he will be worried. What does it mean? Whereas AI can do, it can give a detailed report, and here they have compared the report given by the computer and report given by the doctor, and when he sees it, and it was assessed by various doctors, the AI report, and what they found, this report given by the AI is acceptable without any more editing. That is 73% of the time. And all of them are true and correct in 100% of the cases. And it is preferred by patient in 97% of the cases, and is more understandable than echo reports in 97% of patients' cases. Now, but there are few flaws in the sense there are some incorrect statements by the AI report, but that was only small in 8%, but these are not dangerous mistakes. Missing information also was there. Again, it was not dangerous in a small percentage of cases. But it increased the patient worry by 35% because most of the reports were correct. So it can help clinicians efficiently explain echocardiogram reports to patients in future. Now this is, AI can yield more information from a CT image than just a coronary narrowing. It can tell us about the coronary stenosis. Apart from that, it can also tell us in-depth information on plaque and plaque volume, blood flow, and perivascular fat. So it will give you much more information than just the stenosis. Then machine learning, most of the times we advise a CT for our patients. Either some of them can't afford, or some of them say we don't want because there's a radiation hazard. And machine learning models using signal processed ECGs and clinical variables can accurately predict coronary artery calcium score risk categories. So these simple office-based variables have ACVD risk stratifying capabilities similar to that of CAC score. So our machine learning model performed better than the validated CAD consortium clinical score in a symptomatic cohort undergoing invasive coronary angiogram. So if I have this information, the threshold for coronary angiogram might come down significantly. Now here, a compare of deep learning performance against healthcare professionals in detecting diseases from medical imaging. They took a large data from different specialties, that eye disease, breast cancer, trauma, orthopedics, lung cancer, thyroid cancer, cardiology, nephrology, etc. And what they found, the study found the diagnostic performance of deep learning models to be equivalent to that of healthcare professionals. So only thing was poor reporting is prevalent in deep learning studies, which limits reliable interpretation. So this needs to be corrected in future models. The same thing, as I mentioned, the healthcare professionals, when they analyze the data, their specificity and sensitivity was 91% and 90%, where the deep learning models is almost equal, 90% and 93%. Now it can assist primary care physicians in handling patients' messages. It doesn't happen probably here in Western countries. The PCPs, they get a lot of messages from their patients and they have to answer them. So this has resulted in their workload increasing and almost burnt out cases have happened. So this electronic health record inbox management burden has increased for primary care physicians, which contributes to burnout as it encompasses message drafting, information searching, and documentation. Now, the relief strategies for this is either you have to upskill the staff and you bill for the messages. Both may not be acceptable at times. So solutions again, Gen AI chatbots to automate drafting responses to patient messages. So these will automatically draft the messages to the patient, and what they found was they again looked into these messages generated by AI and found that it was 125% more empathetic, 61% more positive, and 70.2% more subjective when compared to the PCPs. Statistics can be made easy. You give the data, all your data to the chat GPT, and it will give the graphs and the results. You're interested in clinical trial, you can ask the AI to help you form the protocol and even the guidance for getting the approvals. The education, for those who are interested in AI, I would like you to see this in the Spotlight AI JAMA network. It is freely available. AI Clinical Practice JAMA is Visit AI in Clinical Practice. So all can read this. Every time this issue comes out, you have a video which tells you each field, or they cover each field of artificial intelligence. In the thing which appeared yesterday, we had this AI in clinical practice can AI accelerate medical education? You can use it very efficiently, very effectively for educating students in your institutions. Prediction. Of course, it is said that never make predictions, especially about the future. It can predict. It helps predict dementia using speech patterns. So voice recordings may spot who is likely to progress to Alzheimer's dementia in 6 years. So there are studies which have shown that this actually is correct in most of the cases. With all these things available, is AI totally reliable? It is not 100% reliable. Now here is examination in interventional cardiology, 60 questions given in 2 forms. That is multiple choice with forced justification, means you just say multiple choice questions. Other one is non-forced justification, where other questions are you have to explain why this answer is correct and why it's not correct. So what they found was the percentage of correct answers with AI shown in green there was 76% and 61%. As compared to the fellows who did it, it was 82%. So it falls short of what human beings can do or who the fellows can do. So their artificial intelligence is not up to the mark. So it is not totally reliable. That is to be kept in mind. So in conclusion, same thing, the study cautions against relying on ChatGPT for decision making within the field, as it often provides incorrect answers. Now we go on to the strengths, weaknesses, opportunities, and threats. Now strengths, we all know it is very efficient. It can automate repetitive tasks such as data entry and analysis, allowing clinicians to focus more on patient care. I hope we do it. Decision support, it can support your diagnosis and sometimes even treatment plans. It is available 24/7. It is not, it doesn't take holidays. It is not subject to boredom or a burnout. Standardization, it can help standardize processes and protocols, ensuring consistency in care of delivery and reducing errors. Let us go to the weakness part of it. One is dependence. Now, over-reliance on AI systems may lead to decline in critical thinking skills among clinicians, potentially resulting in missed diagnosis or inappropriate treatments. Data quality. AI algorithms basically rely on the data you provide, data quality. So poor quality or biased data can lead to inaccurate predictions and recommendations, potentially compromising patient care. So just to say about the data thing, now, as I mentioned, if you garbage in, what you get is a garbage out. So what you have to do is reliable data, then only you can get correct outcome. Ethical concerns. AI raises ethical questions regarding patient privacy, consent, and algorithm transparency. Clinicians may face dilemmas in balancing AI recommendations with their ethical responsibilities. Cost, of course, implementation and maintenance AI systems can be expensive. Then what are the opportunities? Opportunities are, we can practice personalized medicine. AI can analyze patient data to tailor treatments and interventions to individual needs, leading to improved outcomes and patient satisfaction. We can use it in the continuing medical education. We can do remote monitoring, and we can use it in research advancements. There are, of course, some threats because of AI coming into the field in a big way. Job displacement concerns exist that AI could replace certain tasks traditionally performed by clinicians, leading to job displacement or a shift in job roles. This area is still quite gray. I find it very difficult to imagine what's going to happen. Can it really replace clinicians, which I think it cannot. Legal and regulatory challenges. Suppose something happens to a patient based on your AI recommendations, who is responsible for it? The AI or the doctor? Inequality. AI adoption may exacerbate healthcare disparities if certain populations have limited access to AI-driven healthcare services. Not only that, you provide data from a particular population to AI, so it can give data only from that. Suppose you have excluded minorities, you excluded female gender, so the interpretation it gives will not be accurate, will not hold for the whole population. Resistance to change, of course, we all resist change when it comes in a big way, but I think we need to get adapted to it. Now, interest in artificial intelligence has reached an all-time high. So important thing is where, when, and how to deploy it, and what are the risk, problems, and possibilities which we have dealt with. Now, there are three epochs of AI emerge. First one is the symbolic AI. It attempts to encode human knowledge into occupational rules, computational rules, as well as probabilistic models. Second is the era of AI2 that began with deep learning, in which models learn from examples labeled with ground truth. This era brought about many advances both in people's daily lives and in healthcare. Deep learning models are task-specific, meaning they do one thing at a time, and they primarily focus on classification and prediction. And third is the era of foundation models and generative AI. This will have to wait. The foundation models and generative era represent a major revolution in AI's capabilities, offering tremendous potential to improve care. Now, while any heuristic omits details and loses nuance, the framework of AI 1, 2, and 3 may be helpful to decision makers because each epoch has fundamentally different capabilities and risks. Now, FDA has already approved nearly 191 artificial intelligence devices. And in this only they've added few more and just come to now 882. AI devices are available in the market, probably in US and Western countries. Out of this, only about 10% apply to the cardiovascular system. Now, advancing cardiovascular case with artificial involves patient safety, clinical efficacy and effectiveness, equity and fairness, reliability and generalizability, and financial capability. And the data we have to provide are from ECGs, telemetry and variables, ECO, CMR, advanced EP, counterangiogram, genetics, multiomics, EMR, and other inputs. All have to be the inputs to the AI, and they have to be based on these principles, and that's the way to advance cardiovascular health care. Now, these are words of wisdom before I end. The illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. So we have to learn a lot of things, we have to unlearn a lot of things, and we have to relearn a lot of things before we adapt AI. Are you concerned about the increase in artificial intelligence? No, but I'm concerned about the decrease in real intelligence. Thank you.
Thank you, sir. It's a good overview on artificial intelligence. Everybody speak about, we started learning new terminologies, artificial intelligence, machine learning, languages, different languages, all those things. So definitely you have to utilize the technology. So early detection and also which has a lot of prognosis and predictions and in the treatment and also at the education level there is some help. Every field it has taken the actual importance. You know, people with mammography, see, it can detect early and also predict the probably future cancer. So that is the, especially radiology, imaging technology where we find lot of many radiologists. Now we are having teleradiology. The future, I think, probably the interpretation is almost close to 90% and plus. So wherever there is a specialist not available and in remote areas where we cannot, now we are having a hub and spoke model where ECG is immediately transferred to technology. You are also one of the, so where AI transfers and you read and then pass on the message to thrombolize or not to thrombolize. See, that way it has made a big difference. And we know in our own institute we are doing two works, artificial intelligence based on the ECG, which can predict atrial fibrillation and also predict amyloidosis, hypertrophic cardiomyopathy, pulmonary hypertension. So it's ongoing studies. And echo images, we are with the Indian Institute of Science. So looking at the volumes, wall motion abnormalities, we can predict the coronary artery disease or the ejection fraction. That's two studies are ongoing. So as you rightly told, see, there are certain issues where the artificial intelligence cannot replace, it can supplement our thinking. So we have, it lacks emotions and feelings. That one of the drawbacks, we cannot, unless human touch is always should be there. And it cannot innovate. Whatever the data we have mined, lot of data, electronic records, and lakhs of patients they have taken, genomes, microbiomes, so many things they have taken. Based on the data, we get the result. If the data mining itself is a problem, then we have certain fallacies in the artificial intelligence. Definitely, it is again ethical issues also. One of the things based on the artificial intelligence we treat. So what are the ethical? Should be validated by the experts. So always that is another ethical issues. So I think definitely it is making a big issue. I don't know whether NEET they use ChatGPT and scored 67 people 100 out of 100. I don't know whether there was any interviews of artificial intelligence rather than the natural intelligence. With this, I think I will pass on to Dr. Ramesh for his comments.
Thank you, Professor Iyengar. I think the overall view of what is in store and what likely, yeah, it has its advantages, it has its threats. Advantage, of course, I think is the predictive value. I think that is where I think it will be very useful, at least in primary prevention. I'm sure it will have a big, this one. Of course, in diagnostics, because I do see with CT and MRI seem to be taking a leaps and bounds in use of artificial intelligence. But the big threat, as you also said, is lose of our own intelligence. I think that is going to be a problem because what we discussed in the first half, that may lose because now doctors may not even think. Doctors may not have to interact. Automatically, you put in, feed in, and then diagnosis done. And there's more dependence on the sort of this kind of media, both for the patient as well as the trainers, and lead to a lot of problems in the future. I see that threat also. Well, anyway, I think we can't deny its existence. I'm sure it is here to stay. We have time for questions or comments? No? Okay. Yeah, no.
Thank God.